Welcome, everybody. I'm really delighted to welcome Dr. Matthew Hobbs today. So Matt is currently Associate Professor and Transforming Lives Fellow at the School of Sport and Physical Activity in Sheffield Hallam University. And he also retains his links with New Zealand as an adjunct senior researcher at the Faculty of Health in the University of Canterbury at Christchurch. Now, Matt does some really fantastic cutting edge research looking at urban exposures and has used big data sets in the past. And I'm really excited to hear a little bit more about his work throughout this session. So Matt's going to talk about when environments add up, co-located urban exposures and health across the life course. He's going to talk for about 30-40 minutes. And after that, we'll have an opportunity to ask questions. So if there are any questions that you come to mind as Matt's talking, please pop them in the chat and we'll try and get to them later. Otherwise, at the end, we will do our usual hands up and take questions from the audience. So without further ado, I'm delighted to welcome Matt again and pass over to you, Matt, for your presentation.
Thank you very much. Thanks for that introduction. Can you see my slides all right?
All great, thank you.
Perfect. Thank you. Okay, so thank you very much for that introduction, Rosie. And thanks everyone for your time today. First of all, I just wanted to say that it's a real privilege to be giving this talk today as part of the seminar series. I've been to quite a few of the previous ones, and what I've tried to do is try and build on that content from the previous talks, and also to add something a little bit different, or perhaps a different perspective around how environments potentially don't act in isolation, environmental features, but actually things that we study might co-locate together, and then think about how that might influence things over time to shape our health and well-being. So today I've kind of split the talk into a few different sections, kind of bite-sized sections. So the first thing I'm going to do is talk you through my motivation for working in this area. And then I'm going to share three kind of core ideas. And they're not finalized. They are ideas that I am grappling with, that I am working in over the last few years. And these are, how do we look at co-location? So how do environmental features co-locate? How do environments change over time? And how do the people and circumstances change over time? And I'll finish with trying to bring all that together in some kind of concluding thoughts, but ultimately acknowledging that it's quite a difficult job to build a more complete picture of that interaction between health and place. So that's kind of an overview. That's where we're going. It'll be relatively informal. I'm looking forward to the discussion afterwards. And as I say, these are kind of core ideas that I'm grappling with at the minute. So first off, I think it's well established that the places we live and work in and the places that our children go to school and play in strongly shape our health and well-being. So I'd hope from the audience here today that there's broad agreement on this and it's not too controversial from both a research and policy perspectives. So whether it's the cities that surround us or the towns that surround us, they can support our health and well-being through things like therapeutic access to green space, more walkable streets, access to health services, or they can actually contribute to risk. So through things like indoor or outdoor air pollution, noise, or inequitable health infrastructure, which is potentially harder to access for some populations than others. And I think this recognition has now influenced the kind of urban health agendas around the world, but also more locally within neighbourhoods and healthy cities. And that's really the key point. I think we all understand now that place matters. I think what's less well understood, and something that I've been increasingly thinking about, and what I'll try and unpick today and discuss, is how do these environmental features, whether it's green space, air pollution, or access to health services, co-locate in the same spaces, so in the same neighbourhoods? And how do these environments change over time, which is also another important part of the equation? And then once we've captured that, how do these things accumulate to influence our health over years, decades, to influence both our behavior and our health. So despite the kind of growing recognition of the importance of place, much research at the minute, including my own, still looks at environmental exposures at one at a time or at one point in time. So here's a really nice picture that exemplifies that, where we have a playground or a green space with heavy industry or air pollution in the background. Now, this is not a kind of failing of the field or anything like that. I think it just reflects practical realities where, for example, sometimes we don't have multiple exposures that are easily available. And actually, when we try and get that data over time, that's perhaps even less easily available. So research tends to be conducted traditionally within our kind of disciplinary silos. And also, policies are often, not always, but are often designed around single issues rather than combinations of environmental issues, which are often more difficult to define and work with. So what makes me really interested in this area is that may mean that we may be getting an incomplete picture of the influences of the environment on health. So we know that some features may matter, but we may not know how they interact, how they accumulate, or how they cluster in the places where people are living. And for me, that has kind of created the intellectual tension that motivates all of my work, where we're trying to understand how do these features co-locate, how do the environments change over time, and then ultimately, how do we link this longitudinally or across the lifespan to our health and well-being? Now, and just a caveat, I don't have the answer today, but I will share some thoughts on where I think we might be able to go. So, in terms of a lived reality, if you think about your day-to-day activities, we know that environments co-locate. We know that features don't operate in isolation. And we also know that if we think about it from a life course perspective, the environments that we're living in do not stay static. City centres are regenerated. Air pollution changes over time. And that introduces a lot of complexity. But for me, that's where it gets really interesting, where we try to account for a range of different environmental influences over the life course. So, what we can think about here is that we, from our birth all the way through to older adulthood, we have a range of different environmental influences that may impact on our health and well-being. People may experience the same environment for years on end and have repeated and persistent contact with these same exposures. Other people, if they move house often or move house for different reasons, or change workplaces, actually may have more fleeting interactions with particular environmental exposures. So I think what I'm trying to get to is understanding not an isolated risk factor, but actually overlapping and cumulative influences over the life course. And that kind of fits with that kind of spatial life course theory. So the title of my talk today is What Happens When Environments Add Up? And that's kind of where I'm going. So in reality, us as individuals, depending on where we live and depending on where we go, we know that in terms of a lived reality, we don't experience things in isolation. So what that means from a research perspective is that we may underestimate the true impact of the environment, or we may misclassify people's exposures, if we're not accounting for that all at the same time. So the question we're asking is, how do co-located environments accumulate across the life course to influence health? So if we think about this from a trajectory perspective, an individual that grows up in a neighbourhood with high traffic pollution, low green space, and limited access to healthy food options may face a very different trajectory to someone who's living in a more supportive environment for their health and well-being. So I'm hoping, moving forward, that we can move forward to look at how these things come together and how, if we don't account for the co-location of features, we may miss the cumulative environmental impact on our health and well-being. So that's kind of the motivation for my talk, I'm going to move on to now talking about what can we actually do about co-location and how can we tackle that. So there are a few different options here, and I don't think there's any right or wrong way to do this, really. But one of my first initial motivations for looking at this area was I was working in the area of looking at the impact of green space on mental health. And I read this paper, and it was talking about how on the perimeter of these parks and green spaces, there was actually a whole heap of alcohol outlets or liquor stores. So here I am thinking I'm looking at the association between green space and mental health because I've got measures of green space in my model. But actually, around the perimeter of some of these green spaces were a significant number of liquor stores. So that got me thinking, actually, maybe we need to capture a more holistic picture of the environmental influences on health. And I think related to that, a lot of this clustering of environmental features reflects kind of long-standing planning decisions, economic processes, and social structures that have shaped how these cities have developed. And then my second initial motivation for working in this space was from a paper that looked at the association between takeaway food outlet exposure and fast food consumption. So on the left-hand panel, there is a kind of nice dose-response relationship between takeaway food outlet exposure and takeaway food consumption. However, what was really interesting from this perspective, and what we've seen in some of our papers, was that association was sensitive to the covariates that were included in the model. So on the right-hand side is the same model looking at the relationship between takeaway food outlet exposure and fast food consumption, but with the association attenuated depending on what covariates were included in the model. And I think it's kudos to the authors, because this was really got me thinking about, well, that's really important in terms of what we adjust for in terms of our models, and this showed it so clearly. So that really got me thinking about the more holistic picture of what a healthy environment may be. So we have two options really, or a couple of different options, but one way may be to look at controlling for other environmental influences, and then the other may be to come up with some kind of index of exposure. So during my time in New Zealand as one of the co-directors of the GeoHealth Laboratory, we created a healthy location index. So this was trying to get at an angle of this co-located, not isolated environmental features. And we developed a healthy location index for the whole country based on access to 5 health promoting features, largely related to physical activity and food, and 5 health constraining features. So health promoting would be things like green space, blue spaces, physical activity facilities, fruit and vegetable stores, and the health constraining features were environmental bads, so liquor stores, fast food outlets, locally operated takeaways, and convenience stores. And what we did is we ranked every small statistical area based on their access to the goods and bads together. So in the green areas, we have areas, so this is Christchurch City. This is the interactive tool we created to help policymakers understand what their local neighbourhoods look like, so they could identify communities that they wanted to work with. In the green areas, you have neighbourhoods which have access to both health promoting but not health constraining features. In the purple areas, you have areas that have just health constraining features, but not health promoting features. And then the blue areas have access to both, and the grey areas have access to neither. So this was just really useful. My colleague Lucas, who I worked on with this, we used to call this our pet project because it wasn't funded. So we just did this in our spare time because we were interested in it. But it was really interesting from our perspective because it showed that cities had different urban profiles, which was interesting in itself. This is Christchurch on the South Island of New Zealand, and this had quite a series of what we would define here as health constraining neighbourhoods that didn't have access to health promoting features in a lot of the residential suburbs where people lived. So this was really important for policymakers to see this, and that was probably due to that Christchurch got hit by the earthquake in 2011. So a lot of the urban amenities dispersed into the surrounding suburbs because the city centre was not accessible for quite a few years. So it's quite a unique example, but it's just an example of how we came up with a kind of index of exposure across 10 different environmental variables. At this point, we still weren't really convinced that this was useful. We were like, it looks great. It looks good from a policymaker's perspective. We've seen the expected patterns that we'd expect to see by deprivation and rural urban access, but we still don't know how it links to health. So we did several studies using the Healthy Location Index, and we saw quite consistent associations between the HLI and mental health outcomes in a pooled sample of the New Zealand Health Survey, a pooled sample of the New Zealand Attitudes and Values Survey, and then we've also just got a study underway, a longitudinal study of around 1 million young people in New Zealand over time, where we've also seen relatively consistent associations for depression and anxiety and emotional conditions with the HLI. So what we've got here, we think, is a reasonable measure of co-location that has shown associations with mental health in both childhood and adulthood. What's interesting, though, as a little anecdote, is inevitably we then get asked the question of, well, which part of the HLI is it that's driving the association with health? Is it air pollution? Is it fast food? So then we go back to, after all that, looking at one exposure, because that's what the policy side of things are interested in. So it's really interesting. It's been an interesting process to be part of. And I'm not saying this is the right way to do it. There's multiple ways to do this. Indexes have their own issues in terms of comparability and things, but it's just one way of doing it. And we found it particularly effective for policymakers and communities to engage with what their areas look like and identify areas of priority to work with. So the next thing I'm going to share is changing environments. And I think this has been something that's really important for me working in Christchurch. Christchurch was hit by the earthquake in 2011, and that significantly changed the urban form of the environment. So I think it's a unique context, but something that is important to consider. So a lot of the examples I'm going to talk about now are related to the Christchurch Health and Development Study. That is a 40-year prospective birth cohort study from 1977 through to age 40 in 2017. And within that, there are 24 waves of digitized and geocoded data on the home, school, and work location of these individuals. And a lot of the examples I'm going to talk to relate to this particular cohort study. And the reason I'm going to, in terms of keeping it simple as well, but also a lot of the questions that we've tried to ask have been answered through the Christchurch Health and Development Study cohort. So we kind of introduced a GIS arm to a prospective birth cohort, which worked really well. So one of the things that I've tried to consider is, do we have dynamic exposure? So do we have changing environments and changing people, or do we have spatial persistence? Do we have people in the same neighborhoods with the same environment? Now, we know that people move house. We know that people change their environments. So it's probably a little bit of both, if I'm being honest. But a lot of the environmental features that we study, if we're looking at heavy industry, a lot of those heavy industries remain there over long periods of time. But then other things like transport infrastructure or urban regeneration may change that infrastructure. So then it becomes a bit more dynamic and changeable. And one of the examples, as I've said, that really brought this home to me was the impact of the Christchurch earthquake. So this is the Google Street View images from 2007 and 2020. The earthquake hit in around 2011. And you can quite clearly see here how the urban form of that city has drastically changed in a matter of years. Now, I think this is a particularly changeable context, but it has highlighted to me the importance of trying to capture that change over time, because the environment does change. So this is actually the moment that the Christchurch earthquake hit on the 22nd of February in 2011. It was a magnitude 6.3 earthquake. It caused severe damage through the Canterbury region in Christchurch. So this is a city on the South Island on the east coast of New Zealand. And it killed 185 and injured several thousand. So a significant impact, but it also changed the urban form of the city as well, and was an opportunity to change the urban form of the city. So what we were interested in is, obviously now, if we go back to the Christchurch Health and Development Prospective Cohort study, we actually have a cohort that was impacted by a disaster, which is quite unique. However, we also have a change in environment where we can now start to link that change in environment to the birth cohort. So the first thing that we needed to do was to try and test, can we actually capture change in the food environment over time meaningfully? So the first thing we did was look at major chain fast food outlets, because they're easily identifiable by name, so we know they're comparable over time. So we looked at the change in fast food outlets from 2005 to 2015, because that is either side of the earthquake period. So we computed numerous metrics. This is the relative change. It's a bit difficult to get your head around, but this is the relative change in average distance to the nearest 5 fast food outlets. So we did a whole heap of different metrics. What we saw was that in the purple areas, from 2005 to 2015, these purple areas are essentially the areas where fast food outlets have moved out of. So the city centre is a good example of Christchurch, where we saw the purple area because a lot of the fast food outlets had moved out of that area because potentially of the impact of closing the city centre for several years. And they'd moved over to the western suburbs, which were developed after the earthquake, because a lot of the eastern areas of the city were hit quite badly by the earthquake. So this kind of confirmed what we saw, where we saw the green areas with a kind of influx of fast food outlets over time, and the purple areas where we had a reduction in the number of fast food outlets, or access to, or availability, depending on the metric that we looked at. So the areas like Rolleston, West Melton were new suburbs built after the earthquake, or expanded significantly after the earthquake. So it kind of fitted what we would have expected to see, in contrast to the east, which was hit harder by the earthquake. We then did the same thing for large chain supermarkets, again, because they are easily identifiable by their name. There's only 5 or 6 of them in New Zealand. Now, the findings for this was much more striking. So the purple areas are the areas where large supermarkets have moved out of. The green areas are the areas where we've got a better accessibility to supermarkets. So again, and the purple areas they track quite well the areas that were damaged quite severely by the earthquake. So we can see a shift of accessibility from east to west, where we have a move of supermarkets moving into new developments around Rolleston, West Melton, Prebbleton, and moving out of some of the areas which were severely damaged by the earthquake. So for me, this was a successful test. Yes, we can capture change in the food environment. I appreciate that this is a very different context to some other urban environments, and that needs to be considered. And it is over a 10-year period, but we did see meaningful changes in the urban food environment over time. The next thing I then wanted to do was, we logically had this change in food environment data. So the logical question then was to say, well, how does this change in proximity to fast food and supermarkets from 2005 to 2015 relate to change in measured BMI and waist circumference from age 30 to 40 years in this prospective cohort study? So we were really lucky. Age 30 and age 40 pretty much perfectly aligned with 2005 and 2015. So we had this was when they were aged 30 and 40 years. So we had this conveniently temporally aligned measures of the environment and change in measured BMI and waist circumference. And then we just asked the question of, well, do the green and purple areas that you saw on the map, are they related to, for the people that are living in those areas, changes in BMI and waist circumference that were measured at those different time points? So here we have up the side change in BMI. And along the bottom, we have the relative percentage change. So in Q1, that is the greatest proportional change towards closer proximity to fast food. And in Q5, those are the areas which over time became, the cohort members were further away from fast food outlets over that 10-year period. And we saw we hypothesized it would be in this direction, such that those individuals who were closer to fast food outlets over that 10-year period had the greatest increases in BMI. And we saw the same pattern for waist circumference. So those individuals who had the greatest proportional change towards closer proximity to fast food over time had the largest increases in waist circumference. Now, interestingly, we saw the opposite effects for supermarkets. These are considered more healthy in New Zealand generally. So we saw those individuals who were closer to supermarkets had the lowest increases in BMI and waist circumference. So we kind of, after controlling for the effect of the earthquake and things like that, we did see an association between changes in the food environment and changes in BMI. So that was another kind of tick for me, in that we can meaningfully relate, in this particular context, changes in the environment to changes in health over time. So just to finish off, I'll just talk about the final challenge, which is trying to account for changing people and changing circumstances. So this is inherently linked to what I've just presented there, but I've just got a couple of examples which hopefully showcases how complex it is. So there's two sides of the equation here. We have changes in the environment, the food environment that I've just shown you being an example, but we also have people moving house and therefore are subjected to different environments. So if people change, or if people move house, then their environments change. But then at the same time, the urban form is changing as well. So we have three different things going on. We have to try and capture that change in the environment if we can over time. If possible, we can try and look at co-location. We actually didn't too much in that previous project. But then we have the other complexity of changing people. So again, this can be people moving neighborhoods, or this could be the environment changing around them, which are two kind of different things. And I think for me, this is the most challenging part to model and get my head around. So one example that I'd like to share is just the residential mobility aspect. So I was lucky enough to work with two very talented PhD students over the last 5 years, Dr. Susie Deng and Dr. Phoebe Eggleton, who I worked with on the Christchurch Health and Development Study. And when I was looking back at the work we'd done when I was trying to work out what to do for this presentation, I actually came across some of the preliminary work that we did when we were trying to work out and explore change in people's locations. So this is actually preliminary work that Susie did for her PhD. And this is just 3 time points of the 24 time points at age 30, 35, and 40. And the Sankey diagram basically shows the location of the cohort members by district health boards. So these are different regions in New Zealand. So we've got Canterbury, we have people that have moved overseas, we have people with unknown addresses, and we have a whole heap of other district health boards they're in. And the thing for me, this was just preliminary work, but I think straight away here, we can see the complexity in people's movements and people's movements over time. So this is just 3 waves of data. A lot of people are based in Canterbury because that is where the cohort was originally started. But you can see how people change their locations over time, which means that they would change their environmental exposure. So we have this kind of dynamic exposure on both sides of our association. We have exposure in terms of changes in food environment, but also, or whatever environment we're interested in. But we also have individuals' movements within that and individuals changing, which I think is really interesting and another important piece of the jigsaw. And again, looking at some of the kind of preliminary work that I did with Susie and Phoebe, one of the interesting things, and again, this is just age 30, 35, and 40, and we have here deprivation from most to least deprived decile, area level deprivation, and also those with no data or were missing. And again, we can start to see the changes in because people either move house or the area becomes more or less deprived over time, you have that complexity of change in deprivation over time, which we can then link. And Susie actually did, just to plug some of Susie's PhD work, she actually did some really nice work looking at trajectories of deprivation in childhood and how that relates to adolescent mental health further down the line. So if you're interested in that, I'll put some references on at the end to that. So the really interesting thing for me, though, to take away from this is that, we have 24 waves of data collection. This is just 3. So there is a lot of complexity that we need to try and start accounting for over time. So I will finish off with a few concluding thoughts, and they're not going to be long. So for me, I love working in this area. I love the kind of environmental exposures on health. I think if we can make an impact at a population level to improve people's health and well-being, that's so important to me, and that's why I have this motivation to do this work. Some considerations moving forward, I think, is that I'd like to share with the kind of group and get people's thoughts and discussion points are, one of the things I've increasingly been thinking is perhaps we actually have a bi-directional association here. So what I mean by that is we have a change in the environment that might impact on people's health. So an example would be a change in area level deprivation impacts on mental health. Actually, we may also be looking at it the other way around as well. So other circumstances may lead to a change in mental health, and that may lead to a change in environmental circumstances or a residential move for someone. We did a little bit of work exploring this with the New Zealand Attitudes and Values Survey, a longitudinal survey of adults in New Zealand, and we did see a bi-directional association between area level deprivation and mental health. Something else I really wanted to try and share with you today, but I haven't finished the analyses with Lucas yet, but we actually have a Healthy Location Index version 2 that we're working on, which is a longitudinal co-location. So it's the Healthy Location Index that I showed you, but it shows how that changes over time. And I think that's going to be really interesting to look at how that looks and how that shapes up. But me and Lucas are currently grappling with how we model that and how we show that change over time in co-location. Something just to acknowledge more broadly is that if we go back in time to capture some of this life course stuff, often the data that we have available may not be available. And even when it is, it often takes time, specialist skills and collaborations to understand how all of these things come together and how we actually present that data for public good. Because when we did the Healthy Location Index, we were very aware that we didn't want to label neighbourhoods as good or bad. And we had all sorts of students ringing us up saying, should I live in this neighbourhood that's bad? And all sorts of things that you wouldn't expect. So it's really important, that side of things. And then the final thing that I kind of alluded to is, the appropriate adjustment. So that really the pathways for me linking environmental exposures to health are largely not well established. And that makes adjustment for covariates in the models difficult, and over adjustment a distinct possibility. So they are 4 additional things that I've kind of been grappling with over time. So I'll kind of leave it there. I think I'm probably over time, but I just wanted to say a thank you I know people are extremely busy at this time of year, so thank you for coming along. I hope you found it interesting. I'm going to open the floor for questions. I look forward to this discussion, also to hearing other people that are potentially working in this space and maybe have experienced similar challenges. And if anyone would be interested to connect on LinkedIn or by email, I would be very much open to that, and would just like to thank Rosie for the opportunity and invite to come along and talk. So thanks a lot.
Brilliant. Thank you, Matt. That was fantastic. Really fascinating.